Welcome to Teolumen Insights, where we reveal the hidden forces that shape the way you live and show you how to use them to create real transformation and supercharge your health, mindset, and daily life. Here are your hosts, Emma Greenwood and Nathan Sinclaire.
Welcome to Teolumen Insights. We love diving deep into these fascinating corners of technology, and today is no exception. We're going to be taking a close look at something called holographic med pods.
Yeah, these things are wild. Like, seriously, a game changer for medicine now?
Absolutely. We're talking about the intersection of holography and medicine, like almost straight out of science fiction.
Right. And the craziest part is, it's not science fiction anymore.
For our listeners who may be hearing about this for the first time, could you maybe give us a quick rundown of what a holographic med pod actually is?
Okay, so picture this. You go to the doctor, right? And instead of just looking at those like flat images on a screen, they can actually see a 3D hologram of your anatomy.
Whoa, hold on. Like a hologram they can walk around?
Yeah, exactly. They can see it from all angles, zoom in on specific areas, the whole 9 yards.
Okay, my mind is officially blown. But before we get ahead of ourselves, let's back up a bit. How does holography even work in a medical setting?
Well, at its heart, holography is all about light. You're essentially recording and reconstructing light waves to create a 3D image. It's like a super advanced version of a photograph, but instead of capturing a flat image, it captures all the depth information too.
Okay, so it's not just a flat image on a screen, it's an actual three-dimensional projection.
Exactly. And the level of detail is insane. You can see individual blood vessels, the intricate structures of organs, everything.
That sounds incredible. So this isn't just about looking cool, right? This has real implications for diagnosis and treatment.
Oh, absolutely. I mean, think about it. If you can visualize a problem in 3D, you can diagnose it more accurately, plan surgeries with much more precision, and avoid complications.
Wow, that's a game changer for sure. Now, I know there have been some major advancements in holographic imaging techniques recently. Our research mentioned something called tensor holography.
Ah, yeah, tensor holography. That's the real deal. Basically, it allows for real-time holographic imaging.
Real time. So it's not just a static image, it's constantly updating.
You got it. Imagine a surgeon operating on a patient. With tensor holography, they could wear a head-mounted display and see a holographic representation of the patient's anatomy overlaid right on top of the actual patient.
Wait, seriously, so as the surgeon moves their instruments, the hologram updates instantly?
Exactly. It's like having X-ray vision, but in 3D and way more precise.
That's mind-blowing. Okay, so this real-time capability opens up a whole new world of possibilities.
Oh, tons. Like, think about neurosurgery. With real-time holographic guidance, a surgeon can navigate the brain much more safely and effectively.
It's like a GPS system for the brain.
Yeah, exactly. And it's not just surgery either. Think about diagnostics. Imagine being able to visualize a beating heart in 3D, seeing all the valves and chambers working in real time.
That would be incredible. It would revolutionize cardiology.
For sure. And you know what else is really cool? These megpods can even be used for remote consultations.
Really? So a specialist in, say, New York could examine a patient in rural Alaska using a holographic projection.
Yep, it would democratize access to specialized care, especially for people in remote areas. It's truly revolutionary stuff.
Now, I'm also curious about patient engagement. How can these holographic med pods help patients understand their own health better?
Well, think about it. If you can actually see a 3D representation of your own body, it's much easier to understand what's going on.
Right. It's one thing to hear a doctor explain something, but it's another to actually see it with your own eyes.
Exactly. And this can lead to better informed decisions, better treatment adherence, and ultimately better outcomes.
So we're not just talking about fancy technology here. This has the potential to truly empower patients.
Absolutely. It's about moving away from that traditional kind of paternalistic model of healthcare and towards a more collaborative one, where patients are active participants in their own care.
I love that. Now let's get into the nitty-gritty a bit. How does all this actually work in practice? One of the terms that came up in our research was patient-to-image registration. What exactly does that mean?
Okay, so basically, you need to make sure that the hologram is accurately aligned with the patient's actual anatomy.
Right. Otherwise, it's not very helpful. So how do they do that?
Well, they use what are called anatomical landmarks. These are specific points on the body that are easily identifiable, like the bridge of the nose or the cheekbones.
Okay, so they use those landmarks to match up the hologram with the real world.
Exactly. And they also use a special device called a reference array, which has little markers attached to the patient. This helps track the position of the patient's head throughout the procedure, so even if they move a bit, the hologram stays perfectly aligned.
That makes sense. But even with all that technology, I imagine there's still some margin for error, right? Our sources mentioned something called fiducial registration error.
Yeah, that's basically a measure of how accurate the alignment is. Even with the best systems, there can be slight discrepancies.
So it's about minimizing that error as much as possible.
Exactly. And the good music, the technology is constantly improving. Researchers are developing more sophisticated algorithms and tracking methods all the time.
That's reassuring. Now, I'm curious about the visual experience for the surgeon. When they're looking at this 3D holographic image, is it like those old 3D movies where you need special glasses?
Thankfully, no. Haha. These systems create what's called a virtual image that appears to just float in space. No glasses needed.
Phew. That's a relief. And can the surgeon accurately judge distances and depth in the hologram?
Absolutely. The image is displayed in stereoscopic 3D, which mimics how our eyes perceive depth in the real world.
Wow, so it's incredibly realistic and immersive.
You got it.
Now, I have to ask about AI. We hear so much about AI in healthcare these days. How could AI enhance holographic medpods?
Well, the possibilities are pretty mind-blowing. Imagine an AI system that could analyze a patient's entire medical history and create a personalized holographic representation of their anatomy.
Wow, like a custom-made hologram highlighting potential problem areas.
Exactly. It would be like having a super intelligent assistant guiding the doctor's every decision.
That's amazing. Okay, so we've talked about real-time interaction, AI integration. What about medical education? How are these holograms changing the way we teach and learn about the human body?
Oh man, medical education is going to be completely transformed. Instead of those old, flat diagrams and textbooks, students can interact with 3D holographic models of organs, rotate them, zoom in, even virtually dissect them.
Whoa, that sounds way more engaging than my animal classes.
Right. And studies have shown that people learn and retain information much better when they can visualize it in 3D.
So it's not just a gimmick, it's actually a more effective way to teach.
Exactly. And when you're talking about training future surgeons, imagine the possibilities. They can practice procedures on holographic models before they ever touch a real patient.
Okay, so medical education is getting a major upgrade. What about remote consultation and telemedicine? How are holograms impacting that?
Well, imagine a specialist being able to see a 3D holographic representation of a patient's condition in real time, even if they're thousands of miles away.
So they can make diagnoses and recommend treatment plans remotely.
Yep. And as the technology becomes more portable and affordable, it could be a game changer for providing specialized care to people in remote or underserved areas.
That's incredible. It really does feel like we're on the cusp of a new era in healthcare.
We are. It's an exciting time.
Well, this has been an incredible start to our deep dive. We've covered the basics of how holographic medpods work, their incredible real-time capabilities, and the potential for AI integration. And we've just scratched the surface.
There's so much more to explore.
Stay tuned. We'll be back after a short break to dive even deeper into this fascinating world of holographic medpods. And we're back with Teolumen Insights, continuing our exploration of holographic medpods.
Yeah, it's crazy to think how much these things can do.
Before the break, we talked about real-time interaction during surgery, and I gotta say, that really blew my mind. Can you give us an example of how that actually works in practice?
Sure. So imagine a surgeon is performing a complex fracture repair. They're wearing a head-mounted display that shows a holographic image of the fractured bone, like perfectly overlaid on the patient's actual arm.
Okay, so they can literally see the fracture in 3D as they're operating.
Yeah. And as the surgeon manipulates the bone fragments, the hologram updates in real time.
Whoa, wait, so it's not just a static image, it's interactive.
Exactly. It's like a constantly updating roadmap guiding the surgeon's every move.
That's wild. But how does the system know how to update the hologram? Is the surgeon, like, manually controlling it?
Nope. It's all thanks to some seriously advanced sensors and AI algorithms. The system tracks the surgeon's instruments and the patient's anatomy and adjusts the hologram accordingly.
So it's a real partnership between the surgeon, the technology, and the patient's body.
Absolutely. And this real-time interaction isn't limited to surgery either. Think about a cardiologist examining a patient's heart.
Right. What would that look like with a holographic medpod?
They could use the hologram to visualize the beating heart in 3D, rotate it, zoom in on different areas. It's like having an incredibly detailed, interactive model of the heart right there in front of them.
It's got to be way better than those old, grainy ultrasound images.
For sure. It's a whole new level of detail and insight, and it's all happening in real time, so the doctor can really understand how the heart is functioning.
Now, one thing we touched on earlier was patient tracking. Could you explain why that's so important for these holographic systems to work properly?
Yeah, so patient tracking is all about making sure that the hologram stays perfectly aligned with the patient's anatomy, even if they move during a procedure.
Right, because obviously in real life, people aren't going to stay perfectly still, especially during something like surgery.
Exactly. So they use those visual markers we talked about earlier, the ones attached to the patient. The system tracks those markers and constantly adjusts the hologram to match the patient's position.
So it's like a super precise dance, making sure the hologram is always in sync with the patient's body.
Yeah, that's a good way to put it. And this accurate tracking is absolutely essential for any procedure where precision is key, especially in neurosurgery, where even the tiniest misalignment could be a problem.
Right, the stakes are high. Now, I do want to bring up something we mentioned earlier, that fiducial registration error. Can you remind us what that is and why it matters?
Sure. So fiducial registration error basically refers to those tiny inaccuracies that can occur when aligning the hologram with the patient's anatomy.
So no system is perfect. There's always going to be a little bit of wiggle room, right?
Right. And while the technology is constantly improving, those tiny errors can still have big consequences, especially during surgery.
Yeah, I can imagine. If a surgeon is relying on the hologram for guidance, even a small misalignment could cause problems.
Exactly. So it's all about minimizing that error as much as possible. Researchers are always working on developing more precise systems, and surgeons need to be trained to recognize and compensate for those inaccuracies.
Okay, so it's a combination of better technology and better training.
You got it.
Now let's talk about something else that's super important, data privacy. We're dealing with highly sensitive patient information here. How can we make sure that data is protected when using these holographic systems?
Absolutely. Data privacy is crucial, especially with these systems becoming more sophisticated and interconnected. We need robust protocols in place to protect patient data every step of the way.
So we're talking about things like encryption, de-identification, and access controls.
Yep, all of that. And it's also important to make sure patients understand how their data is being used and that they give informed consent.
Right, so it's not just about technology, it's about ethics and transparency as well.
Absolutely. And this is an ongoing conversation. We need to make sure we're using this technology responsibly and ethically with patient well-being at the forefront.
I completely agree. And it seems like that's a theme that keeps coming up in our discussion. Balancing the amazing potential of holographic medpods with the responsibility to use them wisely.
You said it. It's easy to get caught up in the excitement of all this cool technology, but we got to remember that it's ultimately about helping people and doing no harm.
Right, technology should serve humanity, not the other way around.
Exactly. Now, before we move on, I do want to acknowledge the incredible human ingenuity that's made all this possible.
Yeah, it's pretty amazing. We're talking about something that was once pure science fiction.
And now it's transforming healthcare right before our eyes. It's pretty inspiring to think about.
It is, and it makes you wonder what the future holds for holographic medpods.
It's an exciting time to be in medicine, that's for sure.
Well, we've covered a lot of ground in this segment. We talked about real-time interaction, patient tracking, data privacy. We even touched on the philosophical implications of this technology.
And we're not done yet.
Nope. In our final segment, we'll explore even more groundbreaking applications of holographic technology and delve into the ethical and societal questions it raises. Stay with us. And we're back for the final part of our deep dive into holographic medpods. It's been an incredible journey so far.
Yeah, I mean, who knew holograms could do so much for healthcare, right?
Seriously. And I know we've just scratched the surface, so for this last part, I want to get a little bit speculative. What are some of the more unconventional applications for this tech that you're excited about?
Ooh, that's a good one. Well, one area I'm really fascinated by is the use of holography in mental health therapy.
Whoa, really? I wouldn't have immediately thought of that.
Yeah, it might seem a bit out there, but think about the progress we've seen with virtual reality in mental health.
Right, like using VR to treat phobias and stuff.
Exactly. Now, imagine combining that immersive VR environment with realistic holographic projections.
Okay, yeah, I can see how that could be powerful.
Right. So, for example, a therapist could use holograms to create a calming and interactive space for a patient with anxiety.
Or maybe help someone with PTSD confront a traumatic memory in a safe, controlled setting.
Exactly. It's like taking exposure therapy to a whole new level.
That's incredible. Are these kinds of holographic mental health therapies actually being used yet?
It's still early days, but there are definitely some promising research projects out there. And as the technology gets better and more affordable, I think we'll see it being used more and more.
I really hope so. That could make a huge difference for so many people. Now, we've talked a lot about how holographic medpods can empower doctors and medical students. But what about empowering patients? How can this technology help them understand and manage their own health?
That's a great question, and it's something I'm really passionate about. Traditionally, patients have often felt lost and confused when it comes to your own healthcare.
Yeah, I can relate to that. All that medical jargon could be overwhelming.
Right. And it's not always easy to visualize what's going on inside your own body based on just diagrams or explanations. But with holographic medpods, patients can actually see a 3D representation of their own anatomy.
So it's like having a personalized anatomy lesson.
Exactly. And that can be incredibly empowering. Patients can better understand their diagnosis, ask more informed questions, and feel more confident in making decisions about their treatment.
And some of these systems even allow for interaction, right? Like patients can virtually touch their organs or rotate them to see different angles.
Yeah, it's all about making complex medical information more accessible and engaging. And it can also be really helpful for surgeons to use holograms to explain procedures to patients before surgery.
That makes sense. It can help alleviate anxiety and build trust.
Exactly. It's all about creating a more collaborative and transparent approach to healthcare.
I love that. Well, I think it's safe to say that holographic medpods are poised to revolutionize healthcare in countless ways.
No doubt about it. It's going to be fascinating to see how this technology evolves in the coming years.
And a little bit daunting too, right? It's moving so fast.
Yeah, for sure. It's important to remember that technology is a tool. It's up to us to decide how we use it and make sure it's always serving humanity.
Couldn't have said it better myself. So as we wrap up this episode of Teolumen Insights, I just want to encourage everyone listening to stay curious, keep exploring, and imagine the possibilities.
Absolutely. The future of healthcare is bright. Thanks for joining us.
Thanks for listening.